Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you some of the bad advice I get when it comes to knee replacement surgery and recovery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our videos. So let's just go down the list here. I have quite a few. So first one is early on after surgery. Just rest and recover. Just rest after surgery. Let your body heal and recover. Now you do want to incorporate some rest into your recovery, but really we need to get up and moving early on after surgery. We have to offset some of those changes in muscle strength, in swelling, in pain, in range of motion. So we want you up and moving early. Same day of surgery, you're up and walking, typically with a therapist, and you're going to be walking and moving throughout your rehab. And also you're going to be moving that leg, so working early on range of motion, straightening the leg, bending the leg, getting that range of motion, starting to build early strength and mobility, decreases your risk of having a prolonged recovery, and also decreases the risk of having a complication after surgery, such as a blood clot. So really we want to use that early window of opportunity to get up and moving. You're not going to be constantly exercising, but we want to be incorporating that early exercise is very important. Number 2, on the flip side of that, is trying to do too much, and sometimes that's too much too early. So we're trying to do our exercises 5 times a day, doing as much intensity as you possibly can. We have to find that window of improvement, that window of where we're making changes, if that's in strength, in range of motion, walking ability, but also not going too excessively, either in terms of intensity or volume, that we're going to aggravate your symptoms to the point where you can't do exercises or you can't do activity for, say, the rest of the day or the next day or maybe even longer. So we need to find that happy medium. We don't want to do too little, we don't want to just rest, but also we don't want to do too much in terms of volume and intensity. And that's going to take some guess and check and working with your therapist, working with your healthcare team to find that happy medium where you're getting these improvements, these benefits, but not overdoing it at the same time. Number 3 is comparing yourself to others. I see this all the time. So, we do have some general benchmarks when it comes to range of motion, when it comes to strength. We have kind of on average what we expect to see with your rehab and recovery in the timeline. But really, every person is going to be very different. There's going to be lots of different factors that play a role that's going to make your rehab and recovery different from somebody else's. And even for the same person, for example, if you had a bilateral knee replacement or this is your second knee replacement, your rehab and recovery and a lot of times looks a lot different in terms of how long, how much pain, symptoms, what your particular obstacles and challenges are. So don't really compare yourself to other people because your set of circumstances and factors are going to be much more different than their particular circumstances and factors. So keep those general guidelines, those general benchmarks, and your physical therapist, your surgeon can help you with that. But really don't compare yourself, especially with the nitty-gritty, the nitpicky little details. Everyone's going to be very different. Number 4 is people stop using their walker and get away from their walker as quickly as they can or too quickly. What I notice is early on after surgery, people have a lot of pain and stiffness. And this, of course, is going to affect how you're walking and moving. Now, using that walker, one, it's going to give you some balance and stability, but also you're going to be able to put some weight through your arms and offload that pressure and intensity through your leg after surgery. So using the walker is a great time to work on your walking pattern, trying to put more weight through your surgical leg, trying to take nice big steps, trying to normalize your walking pattern as much as you can using the walker and not being too quick to move to a cane or move to not using an assistive device. Of course, that will be our goal, especially if you weren't using an assistive device before surgery, but take your time with it. Give it due process of practicing your walking, improving your step length, improving how much you're bearing your weight through your surgical leg. That can really improve, and you can do that easier with the support of a walker. Number 5 is trying to go without pain medicine. So trying to grit it out, trying to just, I don't need this pain medicine, there's too many complications, there's too many risks. Knee replacement surgery is a pretty intensive surgery, and there's very few people who I see go through a knee replacement rehab without taking any pain medicine at all. Now, there's some people, based on the surgeon, doctor recommendations, they might not be able to take opioids or certain pain medicine, but the vast majority of people, I would recommend at least using some pain medicine, especially early on. It can be particularly good if, a little bit before your physical therapy, before doing your exercises or walking, take some of that pain medicine, improve your tolerance for those exercises, for those movements early on. And also it just helps to stay on top of that pain. We don't want the pain to get out of control where it's not well managed. It's just not going to be beneficial. You're not going to tolerate things. You're not going to want to do your exercises. And it can kind of get you down a slippery slope early on in your rehab and recovery. So of course, use common sense, follow the instructions. You don't have to take excessive amounts of pain medicine, but use the pain medicine as another tool in your rehab and recovery, and taking it appropriately with the advice, with the guidance of your healthcare team can be very helpful. Similar topic is no pain, no gain. I hear this all the time. Oh, no pain, no gain. Well, rehab and recovery from a knee replacement is most likely going to be painful for the vast majority of people. Doing your bending, doing your straightening exercises, doing early walking and weight bearing, for a lot of people is going to be painful. But we don't have to bring more pain than needed. There's no reason that you have to have pain. If you're doing an exercise and it's not necessarily painful, that's okay. We don't have to go by this model of no pain, no gain. It goes back to number 2, trying to do too much. We don't have to maximize the intensity, put yourself in 10 out of 10, 8 out of 10, 9 out of 10 pain to get a benefit. We can find that happy medium where you might have some pain. It probably will be aggravated a little, but we don't want to aggravate it so much and so intensely that you aren't going to be able to tolerate the rest of your therapy session, the rest of your exercises, maybe either a day or a couple days after that, because you went at such a high intensity, because you had this mindset of no pain, no gain. Number 7 is returning to activities too early. So this may be returning to driving too early, work, recreational activities, whatever that may be for you, if that's golfing, hiking, tennis, athletics, trying to get back to things too early. It's extremely difficult to be patient after your rehab and recovery from a knee replacement. You want to take advantage of your new knee. You want to use it. You want to get back to things and doing things and feeling like yourself. But let's just err on the side of being extra cautious and conservative. Give the time for your knee to heal. Continue to do your exercises. Continue to follow the guidelines of your surgeon and your therapist. Build up strength, range of motion. Let things heal. And let's be safe. Let's avoid risks of having issues, having increased pain, things like that. Your body needs time to adapt to new movements, to the new knee, to new stresses on different parts of your body. So take time, be patient, work back into things slowly and progressively. Number 8 is once you're discharged from PT, you're done with your rehab from knee replacement surgery. And of course this isn't true. Rehab from a knee replacement is a marathon, not a sprint. I always say this. Those 4 weeks, 6 weeks, 12 weeks, whatever it may be, is of course very vital, very important early on recovery after surgery. But really your body is still recovering, still healing for many, many months, up to a year, more than a year after surgery. So your rehab and recovery will continue throughout that time, and really it will continue throughout your time with a knee replacement. So what that means for you is, even though you're discharged from therapy, continuing to do exercises. It may not be exactly like you were doing in physical therapy, but having your set of exercises, having your ability to be physically active still, following all the techniques and all the advice for managing pain, any lingering symptoms, stiffness you might have. The rehab and the recovery continues even after you're discharged from physical therapy. And then this last one is a little tongue-in-cheek, but getting all your info from online, getting all your info from YouTube and the internet. I definitely don't recommend that, even though, of course, I'm coming to you from a YouTube video. You really need and will really benefit from that personalized advice from your surgeon, from your physician, from your therapy team, getting the instructions of someone who knows all the different factors, if you have medical comorbidities, how you were physically and functionally before your surgery, what are some barriers in your home environment. They know all that stuff is best, second best to probably you yourself. So seeking that personalized advice through your own physician, healthcare team, physical therapist is really important. Even though you may get some benefits from videos like this and my channel, really seek that personal advice and utilize that personalized advice still. So I hope you found this video insightful and helpful. Please be sure to hit that subscribe button, hit that like button. As always, please leave your comments, your questions below. I try to get back to everyone I see. Thank you for watching.